What do you mean by cardiac dominance? Ma'am, cardiac dominance means whoever supplies the ventricles, ma'am, that dominance, ma'am. So here we have the left ventricle and here we have the right ventricle. Between these two, we have this interventricular artery. So the posterior interventricular artery, ma'am, whoever gives this branch, that will define the dominance. So in maximum people, we can see here in the diagram, this is the right coronary artery. The right coronary artery goes on to give the posterior interventricular branch. So which is the posterior interventricular branch? This one. So whoever gives this, that will define the dominance. So in this case, in this diagram, we can see right coronary artery is giving the posterior interventricular branch. So in this person is right dominant, and 90% of human beings are right dominant because the posterior interventricular artery is given by the right coronary artery, and most work is done by the ventricle. So whoever gives blood supply to the ventricle will define the dominance. So now what happens in the remaining 10 people also we should explain. In the remaining 10 people, the posterior interventricular artery is given by the left coronary artery. Which branch of the left coronary artery? It is the circumflex branch. So the circumflex branch of the left coronary artery is giving the posterior interventricular branch. So 10% of people are left dominant. In the right dominance, you can see it is directly the right coronary artery which is giving the posterior interventricular branch. But in the left side, it is the left coronary artery which has a circumflex branch. Through the circumflex branch, you have the posterior interventricular branch. So whoever has this posterior interventricular branch coming from the circumflex artery of the left coronary artery, they will be left dominant, and this is 10% of people. So cardiac dominance in maximum people is from the right side, right coronary artery.